Joint pain causes and treatment. Joint pain is an occurrence that many associate with old age and arthritis. However, joint pain may affect people of any age, race, and sex and has many causative factors. Joint pain isn't a diagnosis, but rather a symptom. It should be considered a warning flag that something else is going on in the body. The causative factor may be from one of two broad categories: inflammatory or arthritic joint pain or arthralgia. Arthralgia literally translates to joint pain. It should be only used to describe joint pain that isn't inflammatory. Inflammatory joint pain is described as one or more of the various forms of arthritis. Joint pain can be mildly uncomfortable that doesn't interfere with activities of daily living, or pain that is severe and limits joint mobility. The causative factor will determine whether joint pain occurs with a rapid onset or more gradually. Joint pain may affect one joint or multiple joints. Joint pain may accompany other symptoms of joint damage or disease: localized swelling, redness, heat, stiffness, and loss of or impaired joint function. Acute stage symptoms are characterized by swelling, redness, pain, and possibly a local sensation of heat, indicating inflammation. If coolness makes your pain feel better, then the acute stage treatment is recommended. Apply the sinew herbal ice on your joint to relieve redness, swelling, and inflammation while dispersing accumulated blood and fluids to help restore normal circulation to the joint. This first aid treatment is used in place of ice to significantly speed up the healing process. It reduces the swelling and inflammation more effectively than ice, allowing you to more quickly regain range of motion. Ice is not recommended because it does not help repair damaged tissues and keeps everything in the injured area frozen, causing the stagnation of blood and fluids and the contraction of muscles, tendons, and ligaments. In Chinese sports medicine, ice is not used and is considered a culprit in injuries that don't heal well. Massage your joint with acute sinew liniments to relieve pain, reduce swelling and inflammation, break up clotted blood and stagnant fluids, and stimulate circulation of blood and fluids to help cells quickly repair damaged tissues. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Chronic stage symptoms begin once the swelling and inflammation are gone, but you still feel pain, stiffness, weakness, and/or sensitivity in cold and damp weather. If heat makes your pain feel better, then the chronic stage treatment is recommended. Massage your joint with chronic sinew liniments to relieve pain and stiffness, strongly stimulate circulation and blood flow to damaged tissues, and promote the healing of overstretched tendons and ligaments. Apply the sinew injury poultice on your joint to significantly stimulate circulation and blood flow to damaged tissues, relieve residual pain and stiffness, and further promote the healing of overstretched tendons and ligaments. Soak your joint with the sinew warming soak to bring warmth into the joint to drive coldness out of damaged tissues, increase local circulation, ease joint pain, and increase range of motion. The sinew warming soak is particularly useful if your affected joint is more painful and sensitive to cold or hurts more in cold weather. The soak can be used by saturating a towel in the liquid and applying it to your joint. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Thank you for watching. For more videos, subscribe to our YouTube channel. To learn more, visit sinewtherapeutics.com.